Okay, good morning, good afternoon, good evening, colleagues. Welcome to today's webinar. Before we get started, I think we may just want to wait a minute or two just to give people to log on and be able to join our session. Thank you very much for making the time. We look forward to a very, very interesting discussion today. And we will start in the next minute or two. So if you just give us a minute or two, we should be able to start. Thank you very much.
Alors, je voulais aussi juste intervenir pour ceux qui sont en France, qui suivent en français, en attendant que vous pouvez aller dans la barre, là où on a écrit Globe, et puis vous pouvez choisir votre langue. Donc, si vous êtes en français, prière de choisir la langue française, vous appuyez sur le globe et vous choisissez français. Et donc, vous pouvez suivre directement la conférence en français. Merci beaucoup.
Okay, I think we will get started. So first of all, thank you to everybody for joining us in this webinar this afternoon. The TCDI regional webinar on illicit cigarette trade in Zambia and the Democratic Republic of Congo. My name is Zunda Chisha, and I have the pleasure of moderating today's discussion. It's a discussion that brings together researchers, policymakers, and tobacco control advocates from across the region to explore the scale, drivers, and solutions to illicit cigarette trade. It's a persistent challenge that undermines both public health and national revenues. So our goal today is to really share and compare key findings from studies conducted in Zambia and the DRC, to examine how these findings have related to global patterns and policy experiences from around the world, and to discuss the practical, data-driven solutions to strengthen tobacco control and fiscal systems. We hope this conversation will highlight how the data has already begun informing action around the region, with some commentary and reflections from local experts. To start with, I have a few housekeeping announcements just to make sure that we're all on the same page. The first of which is that this session is actually being recorded, as you may already have noticed, and we will be sharing this recording as well as all associated materials that you will see here presented at the end of the event. There is also a dedicated Q&A session at the end of all the presentations. So we will start by giving out all the presentations or having our presenters make their submissions, and then we will have a Q&A session. But we also have a Q&A function that's available. And if you could please jot down all your questions in the Q&A function at any time during the webinar, and we will try and get to them during this Q&A session. We also have both French and English interpretation, as you may have noticed. So if you could just navigate to the interpretation icon at the bottom of your screen and select the language that you would prefer. At this point, I'd like to pause and maybe give Patrick an opportunity to maybe say a few words in French for our colleagues in French to also be able to get on board with our session before we start. Patrick, over to you. Patrick, I believe you're muted.
Sorry. Je disais bonjour à tous, juste quelques remarques avant de commencer cette session. Pour ceux qui sont en français, nous allons vous demander de choisir votre langue. Il faut aller au bas il y a un icône comme le globe et vous choisissez votre type de langue. Donc, vous choisissez le français et vous pouvez suivre directement la conversation en français. Et puis, nous avons aussi un autre endroit où vous pouvez, on a écrit qui R, c'est-à-dire les questions. Vous pouvez déposer vos questions dans cet élément et puis après, nous pouvons vous répondre quand ce serait le bon moment de répondre aux questions et réponses. Donc, nous vous remercions de suivre ce webinaire. Merci.
Okay, thank you very much for that, Patrick. And to get started, I'm going to introduce our speakers. The first speaker we'll have today is Dr. Hannah Ross. Dr. Hannah Ross is an honorary research associate at the University of Cape Town and a senior research associate at the Vienna Institute for International Economic Studies. She's also consulting for the World Bank, Asian Development Bank, and the World Health Organization. She has over 25 years of experience in the area of tobacco control, and she'll be helping us set the stage with a global perspective on illicit trade trends and control measures. Hannah, very nice to have you on board, and welcome.
Thank you very much, Sunda, and hello, everybody. Bonjour à tous. Unfortunately, my French is a little bit rusty, so it's going to be in English today. But I hope that we will, I'll just have basically 12 minutes to get us to set the stage, as Zunda mentioned, and then maybe I look very much forward to the other presentations as well. So let me start with, first I wanted to say what is illicit trade, but most of you probably know that. It's something that is not legal, and usually in our world of economists, we see it as something that didn't pay tax. Yeah. So how much of illicit trade is there? The estimates are very different for different parts of the world, but many years ago, a colleague and I did a study, and we estimated from the best available evidence that illicit trade represents about 11.6% of global cigarette market. Not really huge amount, less than 12%, but it's more and less in some countries. This, of course, represents a revenue loss, and that's why economists are interested in this area, but also because in many countries illegal cigarettes are cheaper, they also undermine the tax effort, meaning the public health efforts to reduce consumption. So if we could eliminate global illicit trade, governments would have at least $31 additional billion, and a lot of 160,000 lives could be saved. But just like with tobacco use, what is interesting about illicit trade is that it falls disproportionately on low middle income countries, especially in low income countries. And the reason is not because these countries have higher tax. The reason is that these countries have less resources to control their market. Next one, please. So here, this map gives you an idea about how diverse these estimates are. And so we are talking about countries that have more than 30% of their market consisting of illicit trade, and then we have countries that have almost no illicit trade. It's a little bit outdated. The map is from 2017, and the reason is that this is published by Euromonitor, which is a company that mostly gathers data from tobacco industry. So we don't think it's very independent data. We think that the data is driven by the industry agenda. So because these estimates have been criticized, the company Euromonitor stopped generating these maps. So this is probably the last map, as far as I know, that they generate. But they still provide estimates of illicit trade, And in 2024, they said that the global illicit trade is roughly 9.4% and 9.5%, less than the previous estimates. So this looks like we are on a good track, that it's a good path, that we are reducing illicit trade. But this estimate seems to be more or less stable over the years, more or less between 9–10%. But because the size of a cigarette market is already shrinking, these 10% represent less and less volume of illegal cigarettes. So in fact, the world is heading in the right direction. We have fewer and fewer illegal cigarettes. Next, please. So what are the enablers of illicit trade? So there are several of them, and I'll start with the most important ones. Usually, illicit trade is driven by weak legislation. There are some loopholes in the law that can be exploited by criminals, illicit traders. We have recently seen it in Australia, for example. Corruption among government officials, corruptions about law enforcement agencies. Again, this allows the criminals to bypass the regulation and smuggle goods. Then there are, of course, limited resources for enforcement, because in order to control the market, of course, we do need people who are going to help us with the enforcement. Next one. A presence of organized criminal networks. It is, they deal with other goods or do other illegal activities, but cigarettes are sort of easy usually for these criminal networks to trade, because it's a relatively light good, so it doesn't weigh a lot, and it has a lot of profit that they can generate for each pack. So and the punishment, and this is more important, very important, is the punishment is very low. So if you want to smuggle something, it's much safer for criminals to smuggle cigarettes than cocaine, for example. Then we have cross-border challenges. Some borders are not being stable or not being, guarded properly. Then we have some areas with conflicts, and that always, once there is a conflict, we always see that there is that those conflicts are being exploited by criminals and for smuggling of many goods, including cigarettes. And then recently it's e-commerce. E-commerce is also, because it's difficult to often control that e-commerce, it's also contribute to illicit trade. Next one. So taxes are not really driving illicit trade. I think that's, most of you probably know that already. We have many studies now that show it's not the tax, it's not the price, it's actually the enforcement that is driving illicit trade, or lack of enforcement. So this is an example from Bangladesh and Pakistan. What these graphs shows that Bangladesh, the red bar, was increasing taxes and reducing affordability of cigarettes, while the blue bar is illegal trade, and there you see illegal trade more or less stable over the time. The opposite is true in Pakistan. In Pakistan, their taxes have been pretty low, good affordability not changing, basically, in fact, if anything, affordability of cigarettes increasing, but at the same time, the illicit market has been flourishing and growing. See, so we have studies like that from many countries, and we find it over and over that it's not the price, it's not the tax that's driving illicit trade. Next one. So how do we control illicit trade? So from the economic framework, you think of illicit trade market like a regular market. And so what you want to do is reduce, in order to reduce or shrink that market, you want to reduce the benefits that are there from participating in this market. So you want to reduce both the supply and the demand. So I'll start with reducing demand. How do we reduce demand for illegal products? We want to eliminate the distribution channels, make it difficult for the smugglers to distribute these cigarettes, or making it also difficult for people who want to buy these illegal products to find them. The more time you spend looking for these products, the more costly the product is, because time is money. Also, if it's about cross-border shopping, then You want to reduce the taxes, you want to make sure that the taxes are equal on both sides of the border, so there is less motivation to cross the borders. You want to increase the cost of supplying these products by strengthening the border control, by increasing the certainty of severity of punishment, and make sure that everybody is penalized by engaging in tax evasions and tax avoidance. And then when you implement the same regulations for all tobacco products, so there is less motivation to substitution. Next one. This is a big slide. I have only probably 1 minute to go, so I will skip this slide and just say that there's a lot of different means how to control illicit trade, and it usually involves licensing, record keeping, having control of the warehouses, and using electronic means of control. Next one. And this is my last slide, where it's very clear how do we want to fight illicit trade. We need to have effective legislation. We want to have good administrative controls. We should employ technology, collect data, because that is going to help us discover these illegal activities. And of course, what we need most of all is enforcement. If we have a wonderful tax law and nobody is enforcing it, then we are in trouble. So enforcement really important key to all of this. So thank you very much, and I wish you a very nice and productive workshop.
Hannah, that is fantastic. Thank you very much. Really appreciate you setting the stage here. And I think the big take home there is really the fact that, as we all know, taxes are not the reason that illicit trade flourishes. But as you've highlighted, there are several factors that actually are the key contributors to illicit trade. We will definitely get back to you regarding some of the sort of actions that governments can take to address illicit trade, because I think it's important for us to really delve into some of that in our discussion. So thank you very much for setting the stage for that. Next, I would like to invite Engineer Didier Munguakonkwa Mirindi, who's an engineer and a senior researcher at the RISD DRC. He specializes in field surveys and data analysis, and he coordinated the 2022-2023 TCDI study on illicit tobacco trade in the DRC. His work has been featured in PLOS Global Public Health, and he's also involved in national studies on adolescent smoking in the Congo. Welcome, Engineer Mirindi. We look forward to learning from your findings. Please go ahead with your presentation.
Merci beaucoup, Zunda. Merci pour la parole. Sans plus tarder, nous allons présenter les contenus de cette présentation. Nous allons voir un aperçu du commerce, donc de la méthodologie que nous avons, du contexte, de la méthodologie que nous avons utilisée. On va aussi voir les conclusions principales et quelques recommandations. Et enfin, nous aurons une conclusion. Diapo. Slides. Merci. Comme introduction, le commerce illicite des cigarettes, nous savons que c'est un problème majeur, d'abord de santé publique, parce que cela augmente l'accessibilité au tabagisme et cela augmente beaucoup la consommation. Et c'est aussi un problème fiscal parce que lorsque le commerce est illicite, il y a des perditions d'argent qui devrait entrer dans la caisse de l'État. Et cette étude a été menée dans le cadre du projet Tobacco Control Data Initiative, TCDI, en 2023. Et il avait comme objectif d'estimer la taille de la nature du tabagisme, entre autres, comprendre les origines des cigarettes illicites, mais aussi les marques les plus en vogue dans le commerce illicite du tabac. Slides. Comme méthodologie, nous avons utilisé une méthodologie à échantillonnage stratifié Donc, en RDC, nous avons collecté 10 622 paquets de cigarettes à travers 8 provinces de la RDC et nous avons stratifié l'étude dans les zones rurales et dans les zones urbaines. Nous avons utilisé les cadres d'échantillonnage sanitaire, donc la pyramide sanitaire comme cadre d'échantillonnage. Et de prime abord, après la collecte des données, nous avons défini qu'est-ce que nous entendons par cigarettes illicites, c'est-à-dire paquets illicites. Et nous examinions les paquets de cigarettes un à un pour regarder si les paquets étaient conformes à la législation congolaise. Et pour ce faire, nous examinions les timbres fiscaux. Si les paquets ne contenaient pas les timbres fiscaux, nous les déclarions illicites. Il y avait aussi l'avertissement sanitaire qui est obligatoire. Tout paquet qui n'avait pas l'avertissement sanitaire, comme par exemple fumer préjudiciable à la santé, le tabac tue, etc., nous les déclarions aussi comme cigarettes, comme paquets illicites. Aussi, on examinait la mention restriction pour les mineurs. Il est obligé aux fabricants ou aux industriels de mettre cette mention que le tabac est interdit à la consommation et à la vente pour les mineurs. Et donc, par cela, nous regardions aussi si les spécifications qui concernent la teneur en goudron et nicotine étaient aussi respectées. Si l'une de ces éléments réglementaires n'était pas respectée, le paquet était déclaré illicite. Slides. Donc, de manière globale, la méthodologie que nous avons utilisée pour la recherche quantitative, nous avons d'abord obtenu l'approbation éthique pour mener la recherche. La population cible pour collecter les paquets de cigarettes était d'abord les détaillants sédentaires, donc les détaillants fixes, auprès desquels nous avons collecté les paquets de cigarettes. Il y avait aussi les détaillants itinérants, donc les ambulants. Et enfin, nous avons aussi ramassé des paquets dans les poubelles. Comme unité d'observation, il y avait le paquet de cigarettes, mais aussi les entretiens avec les détaillants. Nous avons travaillé dans 8 provinces de la RDC qui ont été choisies de manière aléatoire. Nous avons aussi travaillé dans les zones urbaines et les zones rurales qui ont été aussi choisies de manière aléatoire. Donc, au total, nous avons travaillé dans 32 aires de santé. Slides. Donc, de manière globale, nous avons eu 8,6% des paquets illicites. Et tous ces paquets-là étaient importés. Donc, il n'y avait aucun paquet illicite fabriqué directement en RDC. Mais nous avons aussi découvert qu'il y avait des paquets, 71% des paquets avaient les timbres obsolètes de couleur jaune qui étaient dans l'ancienne réglementation. Mais pendant que nous collections les données, ces paquets étaient toujours en circulation sur le marché. La marque Supermatch et Oris représentaient plus de 90% des cigarettes illicites. Et la majorité de paquets qu'on a constatés illicites étaient importés. Donc, les pays comme le Soudan, l'Inde, l'Ouganda et les Émirats arabes unis étaient les pays où il y avait le plus grand pourcentage de paquets illicites en RDC. Slides. Donc, comme vous le voyez ici, dans les 8 provinces dans lesquelles nous avons travaillé, l'Ituri a présenté le plus haut pourcentage des paquets illicites de cigarettes, suivi du Sankuru. Et comme vous le voyez, les autres provinces ont suivi. Ici, on constate que, comme on va le voir dans les slides prochains, on constate qu'il y a les provinces non frontalières et les provinces frontalières, où on a constaté que dans les provinces frontalières, il y avait un plus grand pourcentage des paquets illicites par rapport aux provinces non frontalières. Et cependant, on a trouvé aussi que dans les provinces non frontalières, quand même, il y avait beaucoup de paquets illicites, spécifiquement au Sankourou, où on a trouvé même 25% des paquets illicites. Donc, la frontière ce n'est pas seulement les provinces frontalières qui présentaient des paquets illicites. Slide suivant. Et donc, en ce qui concerne la part des marchés par rapport aux cigarettes importées, non importées, comme je l'ai dit dans le résumé, et toutes les cigarettes importées, les cigarettes locales, donc les paquets locaux, il n'y avait pas des paquets illicites, mais il y avait 15% des paquets importés, à peu près 16% des paquets importés étaient illicites. Slide suivant. En ce qui concerne les milieux, donc les milieux ruraux et urbains, il n'y avait pas beaucoup de différences. Et la différence ne sont pas significative, mais on voit que tout naviguait dans les 8% dans les deux sites. Slide suivant. Concernant les milieux, donc on a trouvé que les milieux à faible à revenus élevés avaient beaucoup plus euh, de paquets illicites en RDC. Slide suivant. Par rapport aux marques de cigarettes, comme on l'a dit plus tôt, la marque Oris, 71% de la marque Oris était illicite contre 52% pour la marque Supermatch et les autres marques venaient après. Et cette marque Oris est plus prépondérante au centre de la RDC et vers l'ouest, donc Kinshasa et le centre de la RDC. Slide suivant. Par rapport aux origines, l'Inde, les 100% des paquets provenant de l'Inde étaient illicites, 100% des paquets provenant du Soudan, du Sud aussi étaient illicites, 99% des paquets provenant de l'Ouganda aussi étaient illicites. Et il y avait aussi les Émirats arabes unis dont les paquets étaient illicites à 52%. Slide suivant. Donc, on a aussi essayé de voir les facteurs associés. On a trouvé que les zones à faible revenu avaient deux fois plus de probabilité d'avoir des paquets illicites. Par rapport au lieu de collecte, la probabilité était deux fois plus élevée dans les poubelles ou les rues, donc par rapport aux détaillants mobiles. Et puis, plus une cigarette avait des mentions d'aromatisation, et plus il avait la chance d'être illicite. Et par rapport au milieu urbain et rural, il n'y avait pas de différence significative entre les deux milieux. Et par rapport au fabricant, le fabricant Oriental General Trading, qui est une entreprise des Émirats arabes unis, avait plus la probabilité d'avoir des paquets, 5 fois plus de probabilité d'avoir un paquet illicite. Slide suivant. Donc, comme recommandation, il y en a plusieurs, mais ce qu'on a retenu ici pour cette présentation, nous avons recommandé au gouvernement de supprimer complètement les timbres jaunes et appliquer le nouveau système fiscal pour éviter les, 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 les commerces illicites, renforcer les contrôles aux frontières et la conformité interprovinciale, ratifier le protocole de l'OMS sur le commerce illicite et institutionnaliser un suivi régulier des campagnes de sensibilisation de la population contre le tabagisme en général et le commerce illicite. Et enfin, dernier slide. Donc, comme conclusion, le commerce illicite des cigarettes persiste en raison de la faiblesse des mesures de contrôle et de la porosité des frontières en RDC. Et il faut que des mesures de contrôle ciblées et fondées sur des données soient menées dans les zones à haut risque. Et une action soutenue du gouvernement et de la société civile est aussi essentielle pour appuyer la lutte contre le commerce illicite de la cigarette. J'ai dit et je vous remercie.
Engineer Didier, thank you very much for that. I realized the time was really getting to you there a little bit, but I appreciate you trying to get through that as quickly as possible. We will get back to you on some of the questions I think that are already popping in the chat. But for now, maybe we could get some quick reflections from Mr. Milambo. I believe he's online with us. If you could give us some quick reactions, maybe 2 minutes or so, just to sort of get some reflections on how some of this information is already helping the government in the DRC. Mr. Milambo, could you kindly confirm if you're able to
Oui, je vous entends.
give your comments? Yes, please. Perfect. Please go ahead.
Vous disiez comment, puisque je n'avais pas bien entendu la...
Alors, on demande si vous pouvez donner vos commentaires maintenant en tant que ministère de la Santé. Est-ce que après la présentation de ce rapport, si vous avez quelques commentaires à faire du point de vue du ministère de la Santé?
Oui, bonjour à tous et merci pour la parole que vous m'accordez. J'ai bien sûr quelques commentaires à faire. Le premier commentaire est que la lutte anti-tabac, surtout spécifiquement en ce qui concerne la lutte contre le commerce illicite, a bénéficié beaucoup des évidences de cette étude. Et étant donné que, vous savez, depuis très longtemps en République démocratique du Congo, nous menions la lutte sans orientation des évidences. Et quand il y a eu l'implication des évidences liées à cette étude, nous avions commencé à planifier les activités d'élite basées sur les évidences. C'est très important de les noter puisque, vous savez, selon l'OMS, il y a plusieurs stratégies. Mais j'ai compris que les évidences ont amélioré ou sont en train d'améliorer à plus large échelle les différentes politiques d'élite. Ici, j'ai pu prendre les petits exemples, les mesures financières et fiscales. On a, avec cette étude, on est en train d'améliorer les mesures financières et fiscales. L'étude nous a montré qu'il y avait... Allô, je ne sais pas si on m'entend.
On vous entend
Allô?
très bien. On vous entend très bien.
Ouais,
Yes, we can. Please go ahead.
OK. L'étude, je disais, en ce qui concerne les mesures fiscales, par exemple, les financières, l'étude nous avait montré que nous perdions beaucoup de fonds, beaucoup de recettes, tout simplement puisque le commerce illicite se comportait bien. Et maintenant, on est en train de lutter et de faire le plaidoyer pour renforcer ces mesures fiscales, notamment maintenant, nous orientons la politique vers l'assimilation de SIM-tax, qui est une approche en rapport avec la taxation. Donc, dans les systèmes, que ce soit ad valorem, que ce soit le système spécifique. Et j'ai pu dire, avouer ici que c'est en fait cette étude sur le commerce illicite qui nous a aidés à démanteler, à voir nos faiblesses. La protection contre l'exposition au tabac, même les différents circuits de vente, les faiblesses des services de douane, et les faiblesses des conditionnements, d'étiquetage, d'information. Il y a beaucoup d'améliorations. Alors, mon commentaire se base surtout au fait que cette étude sur le commerce illicite, elle était la première, si je puis le dire, en RDC, qui nous a montré, même les provinces où il y a plus le commerce illicite, la manière dont donc le produit est beaucoup plus incriminé, et les portes d'entrée, et les produits les plus consommés. On a eu beaucoup d'éclairage, beaucoup de lumière sur cette problématique, qui n'est pas moindre, hein, c'est pratiquement en matière de lutte, surtout nous, les pays qui n'avons pas encore ratifié.
Mr. Milambo, I'm sorry to cut you short. We really do appreciate your comments, and we'll certainly be reaching out to you again shortly in the Q&A session. But for now, I think perhaps we could pause it here and maybe move on to the next presentation, so we give everybody a time to make their presentations, and then we'll get back to you with your additional comments regarding the DRC study and how that's assisting you. Really appreciate your comment, though. Okay, with that, I would like to invite Dr. Zyambo to make his presentation. Dr. Cosmas Zyambo from the University of Zambia led the National Empty Pack Survey that estimated the scale of illicit trade and identified key enablers and policy gaps in Zambia. He'll be followed by some short reflections from Professor Faston Goma on the findings and how this has been locally used. Dr. Zyambo, very good to see you. Please go ahead with your intervention.
Yeah, thank you so much, Zunda. I'll go ahead and do the presentation. Good to see you, Hannah Rose, also good to see you. So that's my outline. Next. We are all aware that the prevalence of tobacco has been actually increasing in Zambia. So if you look at the data from DHS, that was from, it increased from 15% to 19%. That was from 2002 to 2018. Currently, we stand at roughly 9.5 to 12.3% in terms of the smoking prevalence, depending on the data set that you are using. It's also clear that more than 7,000 people actually die due to tobacco-related diseases annually in Zambia, and these are more attributed to non-communicable diseases. Next. We are all aware that illicit trade actually it undermines the tobacco control policies, in that it increases the accessibility to the cigarettes because they are cheaper, and also increases the consumption of the cigarettes, and also reducing on the government revenue. So the Tobacco Institute of Southern Africa, called the TISA, estimated that Zambia actually has more than 400 million cigarettes that enters the market through smuggling, counterfeit, and also tax evasion annually. That 400 million, just a minute. Okay. So that 400 million cigarette actually translates to about 30% of the total cigarettes on the market. Okay, so there is a need for the context-specific study on the extent and the nature of the illicit trade in Zambia. That way, we are able to inform the development and implementation of the tobacco control policies and the interventions to reduce the access and the consumption of the cigarettes. Next slide. That being the case, we embarked on this study to estimate the proportion of the cigarettes consumed, which were illicit, and also the extent of the tax evasion. And we also looked at the associated factors as well. We went further as well to look at the facilitators and the enablers of the cigarette trade in Zambia. And I need to highlight that this was the first study that we did here in Zambia. So in terms of the methodology, we have two ways. It was a mixed method. So the quantitative and also the qualitative. So the quantitative, we collected the empty cigarette packs in two ways, the retailers and also the street bins. And we defined illicit. If there's no textual health warning, no textual health warning in English, if there's no valid ZRA tax stamp and a duty-free stamp, it means that that pack was classified as illicit. That's on the quantitative. So the qualitative, we went ahead and interviewed the wholesalers, the retailers, manufacturers, and also the ZRA officials, both at the headquarters and also various borders. We need also to take note that we sampled the 25, just a minute, we sampled the 25 districts, both the borders and non-borders as well, and we stratified in terms of the rural and also urban. Next. So it was interesting to note that we collected more than 118,000 empty packs, and the prevalence was standing at 12.2%. 87% of those were coming from the retailers, 13% from the bin. We also need to take note that 10.1% did not have the ZRA stamp. Next. So if you look at the graph, Zambia stands at 12.2%. We have countries like South Africa, Ethiopia, Nigeria, Ghana, which actually the prevalence is much more higher. Zambia relatively is at 12.2%, but you can see that Zambia is also apparently higher than Senegal, Ghana, DRC, and also Kenya. Next. We went ahead to look at the province. If you look at Western Province, was actually the highest. Second was Lusaka and Luapula. We need also to note, and I haven't shown here, is that in Western Province, Sesheke, which is a border town, actually was the district which was the highest in Zambia as well. Next. So when you look at those that were locally manufactured and those that are imported, almost 62% apparently were imported. Those were the ones that were illicit. Next. So we wanted to look at the origin of these illicit packets. We see that China, India, and Zimbabwe were the highest. It's interesting to note Zimbabwe because Zimbabwe is our neighbor, and we shall see on the next slide the implication to that. Next. So our interest as well was to look at the brand. So you can see that Chelsea, Liberty, Time, Change, Camel, and Zack were actually the highest brands. But what is very interesting on this slide is to note that Chelsea, which was the highest, Time, Change, and also Zack, three of them were actually manufactured in Zimbabwe, which is a country close to Zambia. Next. In terms of the qualitative, we also wanted to look at the facilitators and the enablers. There were many factors, but three of the issues that were coming out was weak tax administration systems, the low level of awareness on the extent of illicit cigarettes, and also the desire for the tobacco traders to maximize on the profit as well. I'll not go ahead to read the things. Next. So what were our recommendations? So we recommended the Zambia to implement a track and trace system for all tobacco products, either made in Zambia or imported. So we need to take a leaf from Kenya. Kenya in 2003 was at 15% prevalence of illicit, and that has actually come down to 5% in 2016. And it's because of the implementation of the track and trace system. We also need a digital tax stamp. This is very important as well, so that then we can upload the data into the central data management system. One of the issues that we were actually going through this in terms of limitation, in terms of our data, was even if we had the ZRA stamp, but the question then was how authentic was that stamp? The other recommendation was that we need to increase on the capacity building, training of the immigrations, the police officers, the customs officers, so that they are able to intensify the patrols along the borders. Last but not the least, it's very important that we monitor the illicit trade data. The data that we have now was the 2022, but we feel that we need to continue to monitor. So we need at least after 5 years, we need to monitor this data so that then we're able to look at the indicators, see whether the interventions that we are putting in Zambia are improving or not. Next slide. Okay, thank you so much for listening. Thanks. Over to you, Vunda.
Thank you very much, Dr. Ziambo. I really appreciate you really sticking to time. You are spot on. Thank you so much for that. And of course, a very, very interesting study. I had the opportunity to read a little bit about this study, and I really think it's a really great contribution to the work going on in Zambia. We would like to hear from a local tobacco control expert that's really been working in this field in the country for several years. Professor Faston Goma, if you're available, we would love to hear your comment on this study and any reflections on the usefulness of the findings and how this has already been applied in the Zambian context.
Thank you very much, Zunda, and good afternoon.
Good afternoon.
Yeah, so this study is really a flagship study for Zambia because illicit trade was just but a rumor before this documentation. We were told that there was some illicit tobacco trade going on, but nobody knew the volume, okay? Let alone even believing that it was there, because cigarettes in Zambia are very cheap. And so there was very little motivation for smuggling, so to say. But I think this study has shown us that there is quite a significant amount of illicit trade going on. And now at least we have evidence on which our officers can work in trying to control the loss of revenue. We also have, I think, figures that have given our friends in the health economics field the quantum and figures that will make them calculate exactly how much revenue loss there is going on right now. And it also revealed to the Zambia Revenue Authority that there are particular hotspots that they ought to be concentrating on in terms of controlling, especially smuggling. As Cosmas said, I think we have a problem with Zimbabwe and our Comesa market in Lusaka, which is the capital of Zambia. And I think there's something going on in the other border towns, but very, very small amounts there. But really, most of it, as was indicated, were the porous border with Zimbabwe, which brings in the brands that were top on that list. At least we have some good information, Zunda, and I think on that we can now influence policy action. And we know exactly where they ought to be concentrating going forward. Thank you very much.
Appreciate that, Professor Goma. Thank you so much for your contribution, and we'll certainly be circling back to some of your comments there, just to make sure we understand what sort of actions this can prompt from, the Zambia Revenue Authority and others that are sort of, tasked with dealing with this issue. But with that, I think we'd like to open up to the rest of the participants, to the audience that's been listening in, and really try and bring them into this discussion. I've noted some questions that are already in the Q&A, and I'm looking at them right now. The first two are in French. Perhaps I'll ask Professor Patrick to perhaps take the reign there and just voice these so that we have some contribution from these as well. I believe they're probably directed at Didier, but just in case they're not. Professor Patrick, do you want to take the reins on that?
Thank you.
Just the first two questions, I think, in French.
Yes. Nous avons eu deux questions. I will speak in French and the translation will be there so that we can echo what has been said. La première question que nous avons eue, c'est de M. Fabien Kili de Mezo, qui demande est-ce que c'est possible d'avoir les présentations disponibles, est-ce qu'on peut partager avec? Je pense que la réponse est déjà donnée. Pour la deuxième question, c'est Juvenal Managabe. Il dit qu'il a suivi avec l'intérêt la présentation, cependant, il voulait savoir quelles mesures concrètes ont été proposées et mises en place pour assurer la redevabilité des agents en charge de superviser le commerce du tabac, car selon lui, c'est l'une des clés pour lutter contre le commerce illicite. Merci. So this is the two questions that have been asked in French. Thank you.
Fantastic. I believe that's for Didier. If I could ask maybe the presenters to just turn on your cameras so we can have a more interactive session, I think. Didier, I think this question is really for you. What sort of concrete measures that have been proposed, to ensure implementation and accountability among officials in supervising this trade? What's your thoughts on this in terms of what your study contributes to this?
Merci beaucoup pour la question. C'est une question très, très pertinente. D'emblée, je voulais d'abord dire qu'il existe déjà en RDC un système de suivi et de traçabilité des cigarettes. Il y a un système qui a été mis en place pour imprimer des timbres sur les cigarettes qui ont payé toutes les taxes, donc qui ont suivi toutes les réglementations en vigueur. Et ce système-là permet aux agents de contrôle de pouvoir suivre ou détecter là où il y a des paquets illicites, soit dans les commerces. Cependant, je pense que le PNLCT, qui est le Programme national de lutte contre les toxicomanies et les substances toxiques, collabore avec la DGDA, le commerce extérieur et les autres ministères gouvernementaux, les programmes gouvernementaux pour pouvoir coordonner la lutte contre le tabagisme. Eh bien, il y a encore des efforts à mener. Et il y a aussi le renforcement des taxes. Déjà, comme on parle du commerce illicite, c'est-à-dire que même si on renforçait les taxes, ce sont déjà des fuites. Et il faut que les frontières, au niveau des frontières déjà, qu'il y ait des mesures qui permettent de faire un contrôle suivi des paquets qui entrent dans les pays. On a aussi remarqué que à l'intérieur du pays, il y avait beaucoup de paquets illicites. Donc, il faut qu'il y ait aussi inspection au niveau intérieur dans les pays pour pouvoir lutter contre le commerce illicite en traquant tous ceux qui vendent les paquets illicites de tabac et appliquer la loi pour que ceux-ci puissent.
Okay. I'm not sure what's happening there, but Didier, I think you dropped off the call. Did you still want to finish your sentence, maybe, and then we can move to the next questions? Okay, I'm not sure he's hearing me. We might need to come back to you, Didier. I would like to move to the next questions here. There are several questions that were directed at Zambia. The first one has to do with use of prevalence data. So one is asking whether we could have, more recent data on prevalence. So I think the data that was used was from 2018, and there's been some improvement in terms of reductions in prevalence, but is there more recent data available? But while you're at that, I'd also like to add Catherine's question, I think, which is quite interesting, I think, here on, she sees that there are some South African brands on the graph, on illicit trade, illicit cigarette brands. Do we know the manufacturers of these brands? Can these manufacturers be added to the presentations to show government what may be working, what may be going on? Any thoughts around this? So prevalence, and do we know who the manufacturers of these brands?
Yeah, so
and can we share this?
Yeah, so on the prevalence, yeah, I think that there could be some new data. Remember, we are in 2020. 2025 now, but the data that we use, remember that it was 2028, that was more on the DHS. You need to know that the latest data on DHS was 2022. And at the time when we were actually doing this study, the data was not yet available, so we could not refer to that as yet. You need also to note that currently, though we have some fact sheets on the DHS, not all the data has been made public. That's a very good question. So once the 2022 is out, we'll be able to know exactly where we stand. But I should think that probably due to some of the interventions that we've had in terms of tobacco policies, we could actually see a slightly decline of the prevalences. Now I say so because we have the Global Youth Tobacco Survey, which we just came recently. We saw that there's been slightly a reduction of the prevalences, though I wouldn't say significantly, but at least there's been a decline. So I foresee that if we are to use the current data, we'll be able to see some differences. Now,
okay.
Interesting to look at the brands. So we had tons and tons of brands. We couldn't actually put all the brands there. So we actually highlighted the brands which were coming out more in terms of those which are illicit. There were also South African brands as well. So we only picked the top ones. we had a long list. I can't even remember some of the brands that that we had. But suffice to say that Chelsea, which was actually manufactured in Zimbabwe, was actually the highest. So that graph really was to show where most of the brands are coming, more those that are imported from Zimbabwe, but we have some of those that are coming actually from India and also China as well.
And Dr. Ziambo, it's possible to trace those in terms of the actual companies, the manufacturers behind those brands, I imagine.
In terms of the manufacture, I think the data that we had were showing whether they were local or they were imported. Okay. Yeah,
okay.
I don't think we really itemized like where is it coming from, but I'll need to check the data to see, because we have tens and tens of data. So what we've just shown is just a tip of an iceberg.
Absolutely. I think what's particularly interesting, I think, from our side in South Africa is that we're interested in the manufacturers. Who are the names behind the names, if you see what I'm saying. But it might be something worth maybe re-looking at some of the data that you have, see if that's possible to trace, and perhaps share with our South African colleagues which brands are involved in some of that those illicit brands there. Okay, thank you very much for that, Dr. Ziambo. I will move on to the next question here. We're trying to get through as many of these as possible in the chat. Maud from Malawi says, considering the cross-border dynamics and persistent smuggling across our porous borders, how can regional frameworks under SADC and COMESA be effectively leveraged to establish harmonized enforcement and customs protocols? And what coordinated regional mechanisms could help address illicit tobacco trade and strengthen border management in our region? This is the first of her set of questions. The second is that, how has the illicit tobacco trade affected the implementation of tobacco control measures? Are there any lessons for the region in balancing its economic reliance on tobacco with public health priorities? I think these are fantastic questions. Maud has not indicated who they are directed at, but I think perhaps we could give a chance to any of the panelists to take a stab at it, and even the commentators who might have some thoughts around this issue. I think it's really, really interesting.
Yeah, so let me take a quick snap on that. I think the first question, because in the way to try and control the illicit, you can't control it from one angle, right? You can't control it just in Zambia, because remember that these are cross-border. And we've highlighted that Western Province actually was on the highest. And picking of Sesheke, and so we know that Sesheke borders Namibia and also Zambia. So as much as we are trying to control on the Zambian side, there must be also efforts to control on the Namibian side. So I'm aware that Zambia Revenue Authority, they do have these collaborative meetings to try by all means to control the illicit as a whole, and not as a country. So I'm aware that the SADC actually do have these multilateral meetings to try and control the illicit trade.
That's fantastic. And do you have any thoughts, perhaps anyone else in the room, perhaps around regional frameworks? You know, SADC, COMESA, are these potential platforms that could be used to better harmonize this type of enforcement and, you know, developing some sort of customs protocol? Didier, I think, has the hand up. Didier? I hope it's relating to this question, but if it's not, please go ahead still.
Oui. Merci beaucoup. Par rapport à cette question, je voulais aussi relever une difficulté majeure par rapport au commerce illicite. On a constaté, par exemple, pour la RDC, que les produits illicites qui viennent des pays frontaliers, par exemple, qui viennent de l'Angola ou de la Zambie, ce sont des paquets qui sont licites dans ces pays-là, mais ils ne respectent pas les normes de la RDC. Et ici, je voulais rajouter une proposition dans le cadre de lutte internationale que la législation soit aussi harmonisée à ce niveau-là. Parce qu'on a trouvé en RDC, par exemple, il y a des paquets qui contiennent un message en portugais, mais qui, en Angola, ce sont des paquets licites, mais qui traversent la frontière comme les deux pays sont côte à côte. C'est pourquoi il faudrait aussi cette harmonisation de la législation au niveau transfrontalier pour essayer aussi de coordonner la lutte contre le commerce illicite. Merci.
Thank you for that intervention, Didier. It really, really helps to sort of think through how these sorts of collaborations across borders can really start to address this issue of illicit trade across both countries. I want to move on to the next comments here that I'm picking up on the chat, on the Q&A chat. Catherine, another question regarding is it possible that institutions like REAP and Development Gateway can wrap up advocacy, echoing some of the statements by Dr. Ross? Okay, looks like Andrea has addressed this one. Andrea, do you want to speak about this briefly, or shall we move on to the next question as well? Or perhaps Winnie, I'm not sure.
Sure, just to say thank you, everyone, and thank you to all the speakers. So to share and amplify on my comment earlier, so we are very much wanting to promote this research that indicates that illicit trade is not made worse by increase in taxes or improved tax administration, but we do want to spread this information as wide and far as possible. So obviously the webinar is one means, but if you or anyone on the call has recommendations of other newsletters, fora, meetings that we can share out this research and our TCDI research and websites, we would really welcome placing them in the chat, or if you would like to write to us afterward. But we want to, arm and supply advocates with this messaging. So thank you all so much.
Thank you very much, Andrea.
Zunda, can I weigh in just a bit?
Yes, please go for it.
Yes, so we talk about knowledge translation. So after we have the evidence that we have, especially like in Zambia, we really need to be able to take a deliberate action to disseminate the information. So one of the things that we thought we could do is to go back to ZRA and also go disseminate the information, which we haven't done. We know that Sesheke is a hotspot. Livingston is also a hotspot. Comesa in Lusaka is also a hotspot. So we need to be able to disseminate to ZRA, disseminate to also the retailers where we went. But also we need to go back to the districts where we collected the information. We haven't done that. I know that what we are doing as a webinar is a good thing, but not many people. I don't know how many people from ZRA are here. I don't know how many people who are retailers are here. So we need to take a deliberate approach in terms of disseminating the information and creating awareness to the people in terms of what we did. And I think that is going to be helpful. Let me also take advantage of this platform, Zunda, that also the publication of what we've done is also very key. And I'm happy to announce that the publication has been accepted and it's going to be published anytime soon, what we did in Zambia. So that's going to be part of the dissemination as well. Over.
Thank you very much, Dr. Ziambo. Congratulations on the publication. And I think it's fantastic that you are really thinking about how this loops back and circles to the original communities that are really affected by these results, right? Too often we find we have, great studies being done, and a lot of this information gets hung up in, the higher echelons of policy making, and the policymakers are the only ones that know this information, or the researchers are the only ones that really get to see this information. But the local communities that are really actually being affected by this particular phenomenon, simply not privy to the information of what's actually going on in their communities. They are aware something is wrong, but they don't know exactly how to sort of characterize it and really address it. So it's really, really important that we get this information back to the communities that this information was extracted from. Very appreciative of that comment, Dr. Ziambo. I would like to get to some of the other comments that have popped up and questions that have popped up here. The one is in French. Shall I maybe lean on Professor Patrick again to maybe try and address that one and see if we can get some comments from, I believe this is the DRC question. I see RDC in the French.
Yes, it is.
Sorry, Dr. Zunda, I would like to just draw your attention to a message to the panelists. I appreciate that conversations are robust, but I know, I think we had committed to engaging partners and stakeholders for an hour.
My apologies. I thought it was an hour 15 minutes. So I was looking at the time and I was thinking, yeah, we're okay, we're still fine. My apologies for that. I don't know how that happened. Okay, so if we're completely out of time, then we might as well be wrapping this up. Okay, all right. Thank you very much for that, Winnie. All right, in that case, colleagues, perhaps we could have one comment each very quickly from the final round of contributions from perhaps Dr. Ziambo. I'll start with you. Just last words.
Yeah, I think not to belabor what I've commented on, the data that we normally we generate is the data that's supposed to be used for policy, but also help the people in the community. So I think that the approach that apart from what we're doing as webinar, we need to get back, disseminate into the communities, ZRA, the retailers and the wholesalers, and also the borders where we think that those are hotspots. Over.
Fantastic. Thank you very much, Dr. Ziambo. Didier, would you like to make a final contribution?
Merci beaucoup. Je suis très heureux d'avoir participé à ce webinaire. On a eu peu de temps pour présenter tout, mais je peux juste signaler que nous avons aussi publié un article sur les commerces illicites du tabac en RDC et cet article a été publié en anglais. Et donc, ceux qui ne comprennent pas le français peuvent se ressourcer là-bas. Et il existe aussi un rapport qui est aussi en français et qui peut aussi permettre aux gens de mieux se ressourcer. Merci beaucoup et à très bientôt.
Didier, thank you very much. I won't be asking the other presenters around as well. Dr. Hannah's just left the meeting. She had to unfortunately join another meeting. But colleagues, thank you so much for sticking with us. And even though we went a little over time, I appreciate you still being with us. As we pointed out already, this recording will be shared with you along with all the other material that's been presented here. We thank you very much for being part of this meeting, and we wish you a wonderful day further. Thank you very much.
Thank you. Thank you so much.
Thank you all.